My name is Stephanie Turner. I'm the Palliative Care Discharge Facilitator with the Marie Curie Delivering Choice project. And my role is to support staff within the Trust to facilitate timely discharges of palliative care and fast-track patients.
The Delivering Choice programme is a service improvement initiative that operates in specific geographical areas across the UK that is designed to give patients who are nearing the end of their life greater choice over how and where they're cared for.
My background is as a senior nurse on the wards and working with patients that have got chronic disease. And I've always felt very passionately about helping patients go home, making sure that the discharge has been a good one.
One of the key challenges for the LEADS programme is seen right across the country, and that's a reluctance amongst some clinicians to engage patients in conversations about death, dying and care planning at that stage. That means that such discussions are happening quite late in a patient journey, which then impacts on their ability to return to their preferred place of care.
I don't think you can underestimate the choice of patients and how important it is to them and their families, and whether or not that's about going home or going into a hospice or going into a care home or even staying in hospital. It really gives them some control over what is going to be an inevitable outcome, but it really gives them an opportunity to sort of make a decision for themselves at the end of their life. And what they'll do is they'll get you comfortable once you get home and just get you settled in. As the palliative care discharge facilitator, what I'm able to do is to get the ward staff and the community staff working together so that they're speaking to each other, they know what the plans are, what they would like to achieve for the patient, and then being able to point them in the right direction of other support services.
We have certain objectives in the project. Obviously, we're looking at choice, we're looking at equity, we're looking at appropriate support services for patients and carers, improved coordination, and really making sure information on choice is known to patients and carers.
I'm there to support you and the community team to try and organise these discharge packages, and they're just as a point of contact really.
The King's Fund have been working actively with Marie Curie in the Delivering Choice programme over the past 2 years. This is part of an ongoing programme of research where we will use what we find in Leeds to inform the development of other Delivering Choice programme sites.
We would definitely want to replicate any successful solutions up and down the UK. I know the project and the stakeholders and also the King's Fund feel it's really important to have data and knowledge, so it's not just anecdotal evidence. We've got that qualitative and quantitative evaluation.
The work that King's Fund have been doing with Marie Curie in the Delivering Choice programme sites is a real example of partnership working where we've been able to make a real change to the way that patient care is delivered on the ground, as well as impacting on policy at a national level.
We've had feedback from patients and carers who've said, you know, if I could wave a magic wand, I just want to go home to die. Or actually, it was so lovely having mum back at home for those final few days. So we know it's definitely making a difference. The project now is just looking forward to the independent evaluation to really formally evaluate that. But we know day to day it's already making a difference.